An infant feeding therapist is somebody that specializes in feeding to a breastfed infant, a bottle-fed infant, or both. An infant feeding is a whole synergy experience, which means the whole body is involved. So someone like myself can come in and assist a breastfed baby that's also working with IBCLC, that's having any oral dysfunction or whole body tension that relates to how well or how not well feeding is going. Feeding therapy, also from a speech language pathologist lens, involves looking at the swallow, looking at positioning, looking at how well the suck swallow breathing pattern is going. It also involves primitive reflexes. It also looks at things through the Baby Myo functional lens, which looks at airway. And usually our babies that we see have some type of oral dysfunction going on, which relates to how well they are able to get milk intake, whether that's from the breast or the bottle. We can then make an individualized therapeutic plan that's going to benefit and help the baby develop and meet feeding milestones in the first year of life. So I don't think that we can talk about feeding without talking about tongue ties and how that's such a hot topic right now and all over social media. And tongue tie, there's a lot of nuance. So how do you know your baby has a tongue tie? So we know that your baby has a tongue tie when you get a proper evaluation. Part of that team is going to be potentially your IBCLC if you are breastfeeding or pumping. The other part of the team is going to be a really skilled pediatric dentist or an ENT that can assess structure. And then the other part of the team is going to be where we come in as an infant therapist that is specialized in tethered oral tissues like tongue tie, lip tie, and buccal or cheek ties. And so what we'll do is we'll evaluate structure and look at function. So the key word to find when you're looking to assess if your baby has ties and ties that are needing intervention such as frenuloplasty or release is that how is your baby functioning? Can your baby feed well? Are they able to breathe well? Are they experiencing excessive body tension or muscular strain? Are they experiencing more tension, torticollis, plagioccephaly, or any other signs of overt cranial sacral tension or fascial tension and strains? And so based on that, we'll look at and assess if a baby is experiencing ties that are impacting or impeding their basic function. And so based on that, we will be able to determine if a tie is needing to be released. And we can also provide pre-frenectomy care. So we would be able to do therapy that would benefit and get a child ready for a release. And then we can do post-frenectomy care, which is assisting and helping with all of the muscles being able to work and coordinate the way that they should optimally, so that they are able to not only feed well, but move well, breathe well, sleep well, eat well, play well, and beyond. When a new baby comes in, the process would look like an evaluation. And in an evaluation, we'll look at all things, including oral function, including looking at structure. What does baby's palate look like? What do the muscles of their mouth look like? And we'll look at their milestones, and we'll see how they're overall feeding in a session, and we'll look at their motor patterns. So it'll look like tummy time, it'll look like fascia work, it'll look like reflexes work, it'll also look like different oral motor exercises and facial massage. It'll basically look like a really fun play session, and your baby will be treated like they're at the spa. It'll also look like parent training because we involve the parents in every step of the way. So our therapy is different because we're trained in polyvagal theory-based coursework that involves keeping our baby in a regulated space to learn and grow when we're doing therapy. So it will be a very tear-free experience. It basically looks like play, it looks like fun. Parents are used to in certain therapy models of like the baby is crying and the baby is stressed, and we're always working through a regulation lens to get baby in that regulated zone. So we're very aware of your infant's nervous system and very sensitive to that, and also working with the dyad and making sure that we're best supporting parent and baby together, and so that parent is enabled and empowered to be able to carry over the exercises and learn and incorporate those things during play throughout their day pretty easily. And so we're always here for supporting the parent to best be the therapist outside of our office.